So you can make a list and keep handy for yourself. This Healthwise handbook gives you a lot of these sites which, yes, yeah. Yeah, you can keep such books handy with yourself.
Very simple.
It gives you information on all diseases.
Yeah. And why you get involved in insisting upon a patient?
Yes, we are. Whichever doctors we are talking to, hospitals we are talking to, we are holding a conference in October, this coming October. Mr. Ken Long from Healthwise and Health Library have partnered together to have this conference in October. We'll send you a...
Yeah.
So these are the ways in which we are also trying to bring it out into the open. There is no need to just sitting here and talking. We do bring it out in the open. Dr. Malpani has got contacts with doctors. He talks to doctors himself. So learn to get reliable information. So I will be taking up those in the future sessions also. We'll go deep into this topic, how to get reliable information. We'll do a workshop on what is reliable and what is not, what is required and what is not required. So how do you process the information that you have gathered from the internet? Understand your treatment options first. Sometimes you have various options. So understand what are the options available to you. For example, in cardiac diseases and all, you'll have various options. Someone will say a stent, someone will say just an angioplasty will do, somebody will say, oh, go for bypass. So understand the options first which are available to you. So these in detail you do not have sufficient time with your doctor, but you can do an intelligent search on the internet, come to the library, read books, read experiences of other patients, interact with other patients, go to the websites particularly made for these kind of diseases where people have already written about what they have gone through. Take the advice. Now once you have these treatment options, another thing you can do is take the advice of your doctor or a friend who is a doctor. We all know somebody, or maybe a family physician also, that's the best source. He has all the time for you. So take an advice. Once you have done your research, once you have taken out the information, take that information to your physician or to a friend who has time to talk to you about these options. You then need to decide which treatment is best for you. See, we all get to know, I think this is good for me. I think this treatment looks okay for me. We are not doctors. We don't know exactly. But we feel I'll be more comfortable with this. That is it. Afterwards, it's not a decision. This is just your comfort level which you come to. After that, you talk to your doctor about it. First you understand. If you don't understand and you go to the doctor, you are left with no choice. I'm coming to that. Yeah. You have no choice. You are ignorant, you are sitting there, you accept everything and come. Is that a good option? Or is the option of being informed and then still going along with what your doctor is telling you? At least you made a good choice. You will still understand why your doctor, even if you made a choice, no, I don't want this, I don't want, I want only angioplasty, I don't want a bypass. But your doctor will then be able to make you understand why he is opting for a bypass. You will be in a better position to understand your problem because you've already come informed. So some choices that you can, what would be the costs involved? So there are some costs, there are some operations which are more expensive, some are less expensive. It should again fit into your budget. What benefits would accrue by each option? Write down the pros and cons. You can do a SWOT analysis, strengths, weakness. What are the risks involved in each of the treatment options? What are the alternatives available? Now suppose if I am not going for this, then what else is available for me? Suppose a private hospital is more expensive. Is there a public hospital which I will be comfortable with? So know your choice, know your options. Now too much information can also leave us feeling confused. Yeah? That's what happens when we go on the internet. There's too much information. And there are advertisements also, this drug is better than that, and this drug has created a problem here and problem there, and this is bad for us and that is good for us, or my doctor has prescribed something like this, but this patient is writing something bad for this drug, and it confuses us completely. But what we think is better to be confused because you know too much, rather than because you don't know enough. You can always get your doubts clarified by your doctor. You can always go to the doctor and say, this drug, something was written on it. So doctor will tell you again, no, the latest is this. The latest is that research was wrong and this research is right. What I am telling you is the latest. So again, you gain confidence and to work with your doctor for your treatment options. Ultimate rewards of doing your homework will be your peace of mind, that you did the best that you could do. So how to research some medical literature, some quick points here. Obtain some basic information on your diagnosis. Spend a little time thinking about exactly what questions you want answered. Your doctor certainly should be the first source of information. We cannot make some wild guesses and say, oh, but I have pain here, he didn't say that. So I don't have this, I have something else. No, but a doctor is the person to give you that information. Researching is not a step-by-step process where after this I will do this, after that I will do that. When you're searching, you'll come across a cycle of questions. You know, it's a cycle. You click on something and then something else interests. It's like you're clicking here, you're getting this information, then you're getting some information on something else, then you're getting information on some other thing. So make it like a structured, at the end of it, jot down all the points and see what is relevant for you. So what are the sources that we come across on the internet is references are there, abstracts, and there are papers. References look something like this. Here you will get the title of the title of the disease, and they will tell you who has done the research and where it is available, which journal it is available. These are too technical for lay people to understand. There is no doubt about that. But this is some information you can gather from what is being done outside on your own medical condition. Abstracts give you a little more information than a reference. Abstracts are some, they take out some kind of a brief note from the main paper or the main journal, and it's all there on the internet. PubMed is a very good source of information. For example, the HealthWise database is also very easy to read, very easy to understand language. There are images and everything. Papers, and these could be an article published in a journal or proceedings of a seminar or a conference. A lot of conferences are taking place all over the country. I'm talking of India for us, for our purpose, or all over the world, I should say. So a lot of these conferences have now started putting up the whatever discussions have taken place, whatever the speakers have come out to talk to us. They're placing it full video. They're placing full videos on the websites. Last year we had a conference that is patientpower.in. If you go to that, you will find full videos of Okay. The paper is the actual report of the work. It's the actual work that the doctor or the researchers have gone through. You can always take a printout of this to your doctor. Is this relevant? There are a lot of times now, of course, we can get into the thing that a doctor will say, no, what you have brought is all rubbish, or those are different issues to tackle. But this is for our own sake that we need to do. A lot of people have come here saying, no, I need information on this. They pull out information from journals and they take it to their doctor. It has helped them. They keep coming here for their friends' diseases, for their wife, for their spouses, because it has helped them. Why do they keep coming back? It really helps them. There are other databases available, for example Medline and now HealthWise also, which I brought out today. The crux of the whole thing is we need to form a partnership with our doctor. It should be the partner should be between well-informed equals, like I've said over here, like Dr. Malpani has put in his book, which is why you need to do your homework thoroughly.
Very important.
We have to do our homework.
Doctor, the truth. How will you do?
Yeah. So we have to do our homework. This is our responsibility.
Just like I just now told you, my son's mother-in-law and mother-in-law, they were hiding. So that sickness is not going to wait for you. You have to open your mouth and tell. Then only there will be 10 people to come and help you. Then from second step, the fourth is gone. So who is responsible? You are responsible. You don't blame the doctor. No, why blame the doctor? When you don't tell him, you go to the doctor, I'm telling you the truth, my own wife. She doesn't like to go to the doctor. You go and tell her, you are not well, you go into the doctor, why I should Same case with her daughter-in-law. She's in office, she phones me to tell doctor, then I have to go in front of the doctor, tell him, I am Mrs. Daruwala, and now this is the phone, you talk to her, and now you give the medicine. What happened? You have no time for your own self. That's wrong.
But doctors also don't appreciate
Hey,
if
yeah.
patients are not
He is a family physician, he says, he has come, okay. But, because I am going to him for last 35 years, so he has it. Other than your wife, I have not seen her, I will give medicine.
Yeah, how can they give medicine without seeing the patient?
It is exactly what? Condition of the patient.
Yeah.
My wife is this, I am telling you the truth.
Okay, like you do exaggerate.
But doctors want to ask questions. How can they ask you? They have to ask the
When
patient.
I tell a company,
Yeah.
then you go and tell and get medicine. Laziness, wrong. And when you are not well, go to the doctor, tell him everything, tell the truth.
Tell the truth.
They don't tell the truth. This is
Okay.
it. I'm sorry. Yeah.
Or you guess, sir? You guess what's wrong with me?
No, I was telling you, I tell you, when I was taking wheat grass, my wife used to make fun of me. Arey, what you're taking grass ka pani like a boat, etc. Oh, I used to eat a lot of salad with grass. Now, recently, last 2-3 years, she started getting constipated. She was not telling. Then my daughter said, "Can you see like this?" I told my wife, "You are not telling me, you are telling your daughter. You must act with me first. I'm here, you tell me." Then I said, "What is that?" So I said, "It will throw you on piles. You get this problem, so it frightened me. What to do?" I said, "Start off with wheat grass." I started giving her wheat grass. She's fine. I got medicine. Helen Hati now. She takes regularly wheat grass. Very good for her.
So now she's become a goat.
No, she's fine. I'm fine because now she goes to the toilet twice or thrice. Motions are clean. She's Helen Hati. I could take her to Australia. I took her to Double Four. Took her everything. Other problem? Every time. And then what is it? You should take your problem and going.
Yeah.
Raising it, it's very good, I think. Wheat grass, I have to read about
The
it.
next time we'll be talking on caregiving.
Yeah.
Yeah. For carers, for the
Caregivers,
patients.
yeah.
I will be inviting somebody to come and talk on this subject also. That will be in the 3rd week of August, because the 2nd week is Raksha Bandhan Day, and we'll do it in the morning. Yes. So
You said you wanted to shift it in the afternoon.
not yet.
Not
Not yet.
yet.
Yeah.
Third week.